Forget Prozac and Valium. Try eating this common herb instead. Lavender. It's commonly used for anxiety, stress, and insomnia. It's also been used for depression, dementia, pain after surgery, and many other conditions. Most often, it's used as aromatherapy oil, or even the flowers are put inside a pillow to help sleep. But many people are unaware of it being taken internally. Existing pharmacotherapies for anxiety disorder are limited by their delay to therapeutic effect, their dependence, their tolerance, their withdrawal, and their potential for abuse. Therefore, safe and evidence-based complementary or alternative therapies may be important allies in the care of patients with anxiety disorders. Lavender essential oil has an extensive anecdotal history of anxiolytic benefits that have recently been supported by clinical studies. The two primary terpenoid constituents of lavender are linalool and linolene acetate. They may produce the anxiolytic effect in combination via inhibition of voltage-gated calcium channels or reduction of the 5-HT1A receptor and increased parasympathetic tone. In mice, a standardized lavender oil was used along with diazepam, pregabalin, and other oil-based terpenes as active controls to investigate pharmacodynamic properties. Interestingly, the standardized lavender oil lacked appreciable affinity for serotonin, norepinephrine, or dopamine reuptake transporters, as well as monoamine oxidase or GABA receptors, suggesting a novel mechanism compared with traditional anxiolytic therapies. A randomized, blinded, placebo-controlled crossover trial with 17 healthy volunteers investigated brain changes detectable by positron emission tomography and magnetic resonance imaging after administering 8 weeks of lavender oil at 160 milligrams per day. The investigators focused on the inhibition of the 5-HT1A receptor because of increases in activity of this receptor being highlighted in the pathophysiology of anxiety in previous neuroimaging studies. They found reduced binding potential at the 5-HT1A receptor in the hippocampus and the anterior cingulate cortex in the lavender oil group compared with placebo, which has also been demonstrated after administration of the drug escitalopram in patients with anxiety. So the authors postulate that the reductions in the 5-HT1A receptor may be a co-modality in the anxiolytic efficacy of various interventions, and that lavender oil also acts via this mechanism. Additional to the central effects, lavender oil also appears to have peripheral effects that may be important to its mechanism of action. Lavender oil has displayed increased parasympathetic activity as well as decreased hemodynamic parameters in rats, dogs, and humans. These effects may help alleviate somatic symptoms of anxiety characterized by autonomic arousal. Lavender oil has been granted the generally recognized as safe status by the FDA, which means that it is safe for use for its intended purposes as a food additive, whereas many other essential oils aren't, as they can be irritants, inflammatory, and even cytotoxic. Also, lavender oil exhibits many desirable properties of an anxiolytic agent, including a calming effect without sedation, as well as a lack of dependence, tolerance, or withdrawal. It is, however, important to use a product that contains the correct dose, which is 80 milligrams of lavender oil per day, that's prepared for human consumption with the correct extraction methods. 3 clinical trials were identified which investigated the efficacy of oral lavender oil administered once daily in doses of 80 milligrams per day in subsyndromal anxiety disorder and generalized anxiety disorder patients, as well as in restless and agitated patients. Anxiolytic effects of lavender was superior to placebo in 221 patients suffering from anxiety disorder. In addition, lavender improved associated symptoms such as restlessness, disturbed sleep, and somatic complaints, and had a beneficial influence on general well-being and quality of life. In line with this study, the efficacy of a 6-week intake of oral lavender oil preparation compared lorazepam, and this was investigated in adults with generalized anxiety disorder. This study indicates that lavender effectively ameliorates generalized anxiety comparable to 0.5 milligram per day of lorazepam. Alleviation of anxiety and mood improvements were reported in 36 patients administered to an intensive care unit who received lavender oil aromatherapy. The same results were reported for 14 female patients who were being treated with chronic hemodialysis. A survey in a long-stay neurology inpatient department showed increased mood scores and reduction of psychological distress following aromatherapy with lavender, accompanied with tea tree and rosemary. An investigation on the effect of lavender aromatherapy on anxiety and depression in the high-risk postpartum women showed a significant improvement of the Edinburgh Postnatal Depression Scale and Generalized Anxiety Disorder Scale after 4 weeks of consecutive administration of the lavender. As there are many possible benefits to consuming lavender, and it may help to reduce depression and anxiety, it's no wonder so many are trying this natural remedy over pharmaceutical drugs that come with numerous side effects. Check out my other video on novel treatments for anxiety disorder for more possible alternatives to prescription drugs.